After doing the first, second, third, and fourth procedure, you may gather all necessary equipment and perform hand washing and put on disposable gloves and gown. After that, lay the patient on his or her back with one pillow in place and straighten body and limbs in supine position with bed flat. Next, gently close patient's eyes if open by applying light pressure for 30 seconds. In case of corneal or eye donation, close the eye with gauze, moistened with normal saline. Take note, do not apply tape. Remove watch, jewelry, and all possessions. Give it to the nearest relative. Remove IV line and other tubes unless autopsy is to take place. Place a disposable pads to the perineal area to absorb any stool or urine release as the sphincter muscle relaxes. After placing disposable pads to the perineal area, drain the bladder by gently pressing on the lower abdomen. If there are any exuding wounds, should be covered with absorbent gauze and secured with an exclusive dressing. Also wash the patient if necessary, unless requested to not to do so for religious or cultural reasons or patient has died in suspicious circumstances. Also, clean the patient's teeth and gums using a moistened, soft toothbrush or suction to remove any debris and secretion. Clean any dentures and replace them in the mouth. Keep the jaw closed and teeth in place by placing a small pillow or rolled up towel under the patient's chin. Also, tidy the hair as soon as possible after death and arrange into the preferred style if the patient should not be shaved. If the wrist identification band in place, the deceased person has a known infectious disease. You must inform anyone else who comes in contact with this patient. Attach a second identification tag to the ankle or grade 2. If the body is to be viewed, replace top linens and tidy the unit and wrap the body. Attach the identification tag on outside if facility policy indicates. After that, transport body to facilitate morgue or wait for the arrival of mortician. Put away or dispose equipment and supplies used according to the hospital policy. Remove gloves and apron, dispose according to hospital policy, and perform hand washing. After all the procedure, document post-mortem activities. This is for legal purposes and proper documentation of care.